Well, New South Wales has recorded 9 new cases of coronavirus in the past 24 hours, 7 linked to the Northern Beaches cluster. 2 cases remain under investigation. Reporter Tim Swanston joins us now from Sydney. And Tim, as we're reporting another day of low case numbers.
That's right. It's fairly good news in all respects. I mean, more or less a continuation of the last 2 days. We've just seen 9 new cases of community transmission of coronavirus here in New South Wales. And as you said, 7 of those have been linked to the Avalon cluster at the Northern Beaches, which takes that cluster to about 104 now. 2 of those cases are, though, still under investigation. Now, given the number of tests that have occurred, essentially this is quite a positive result that the Premier did indicate, but ultimately the state is certainly not out of the woods. With respect to people who do live in the Northern Beaches area, there is a concern that people could have been travelling from the area when the state didn't awfully know too well about the cluster yet, travelling into the CBD, and essentially that they're worried about chains of transmission that they're not exactly on top of. So by any stretch, not out of the woods is the message from the Premier, and over the next few days, even into Christmas, we need to remain as vigilant as we can.
So, Tim, what do we know about the 2 cases under investigation?
Yeah, so of those 2, we have a man in his 20s who resides in the Northern Beaches. Now, although he's tested positive, his roommates so far, his household so far, have tested negative. The second case is a CBD worker. Now, of concern is this is essentially the 3rd CBD worker to have contracted coronavirus. So it's an office worker in the vicinity of the Hunter and Bligh Streets in Sydney CBD. So as a result, a broader alert for people who work in that part of the CBD has gone out to very closely monitor their symptoms, get tested if possible. So that's the area like Australia Square, the MLC Centre and Chifley Square, that they should be as alert as they can. There's also a growing list of contact tracing locations related to this latest outbreak. We've heard from the Chief Health Officer, Dr Kerry Chant, that one of concern is the Paragon Hotel Sports Bar near Circular Quay.
One of the new cases reported today, which is under investigation, attended the sports bar of the Paragon Hotel in Loftus Street, Sydney, near Circular Quay. They are believed to have acquired the virus while visiting the hotel between 12:45pm and 3:30pm on Wednesday the 16th of December. This is the 2nd case of transmission at this venue, which now has 3 cases associated with it.
And of course, Tim, anyone concerned should check out the New South Wales Health website. Just on to the other issue of testing. An extraordinary number of tests were carried out yesterday.
Yeah, the Premier said she almost fell off her chair when she heard that news. 60,184 tests. Now, that's up on 41,000 yesterday, which was a previous record. So in terms of that showing, the Premier and the Chief Health Officer have been incredibly glowing about the community to come out, their ability to go out and get tested over the last day or so. But of course, that advice is continuing, especially Christmas, Boxing Day, if people start to develop any coronavirus symptoms, to make sure that they go and get tested. The Premier has, of course, reiterated that message and also said that testing clinics will be very available over the coming days as well.
You happen to develop a symptom on Christmas Day or Boxing Day, please go and get tested. We will have 300 clinics across the state, private, government, pathology testing units working throughout the night, private and public. Our health people and the supporting pathologists have just been amazing. So even if you get a symptom on Christmas Day or Boxing Day, please go and get tested. Do not wait till the 27th, because if people wait, you could be unintentionally infecting people and ruining Christmas for those closest to you. So our message strongly is please get tested no matter what day it is.
And on top of that advice about testing, the other key advice is essentially for residents to be limiting their mobility. So although it's of course appreciated by the state's health authorities that we've got Christmas, Boxing Day, festivities and the like, one of the best ways to of course curb the spread of this virus is to ensure that people aren't seeing too many different kinds of groups. So that's the advice for the coming days, but of course ultimately a relatively positive result for today's figures.
Tim Swanson joining us from Sydney. Thanks for the update. To Queensland now, and that state has recorded 2 new coronavirus cases. One is a crew member on a super yacht off Cairns, and the other is a man in self-isolation after returning from Sydney's northern beaches. The Queensland Health Minister, Yvette D'Arth, says despite 100 days without a local infection, the state must remain on high alert.
Today, we can report 100 days since we had a locally acquired case. 100 days, and that's because of the amazing work of all Queenslanders. We want to say thank you on this Christmas Eve for all the great work that people have been doing, our businesses, the tourism sector, our pubs, clubs, hotels, right across Queensland. It is the great work of Queenslanders working together, united, that has meant we have gone 100 days since a locally acquired case. But we cannot afford to get complacent, because with the positive sewage that we have and the fact that we have this positive case from the northern beaches, we believe that we have positive cases in Queensland. We hope every one of those positive cases are in quarantine and isolating as directed.
That was the Queensland Health Minister, Yvette D'Arth, speaking earlier today. Well, final preparations are underway for a March rollout of a COVID-19 vaccine here in Australia, with the government signing contracts for the distribution of the vaccine doses. The Federal Health Minister, Greg Hunt, says the vaccine will be distributed to all Australians equally.
We have engaged DHL and Linfox to help distribute the vaccines. In particular, it's one of the largest logistics challenges in Australian history, and especially with a vaccine that requires a minus 70 degree constant temperature in terms of the Pfizer vaccine. But we'll be distributing to all Australians equally, and most significantly, we're on track and ahead of schedule with regards to all our preparations for a March rollout, and building on what we've done this year with containment, the preparations for vaccines, and Australia's great take-up of vaccination historically means that we're in a very strong position. Well, I think it's very important that we have the assessment, and there are 3 big parts to this. There is the assessment, which relies on the data from the vaccine companies. There is the production, which relies on them being on schedule, and then there is the shipping and distribution. All of those are on track, and we're ahead of schedule, but our whole approach has been to provide confidence by under-promising and over-delivering. We'll set the March expectation, and obviously we work to not just achieve that, but to put ourselves in an even stronger position. But there's no country, to the best of my knowledge, which has given a general population vaccine approval, where there have been hundreds and thousands of daily deaths in the UK and the US and some other places. They've given an emergency authorisation before all the data's in. The critical thing to high vaccine take-up rates is high confidence in the assessment process, and that's what we're delivering for Australians. Our goal is to make sure that that everything's in line for a safe, effective distribution beginning in March. We always aim to, as I say, under-promise and over-deliver, but March is our national guidance and expectation. The allocation will be determined by the medical expert panel based on the different suitability of different vaccines to populations. For example, with the flu vaccine, we have had in the last few years different vaccines for older Australians as opposed to the general population. That's an assessment process that the Vaccines Medical Expert Panel, led by Professor Brendan Murphy, is working on right through the course of the Christmas and New Year break.
The Federal Health Minister, Greg Hunt, speaking earlier today.